Hey, my name is Emily Corley. I'm a student physical therapist assistant at Jeff State. Today, I'm going to be doing an oral presentation on a patient with a rotator cuff repair for PTA 232. So a little bit about this patient. He is a 28-year-old male, status post 6 days rotator cuff repair on his right shoulder. He's a painter, and so he's been doing a lot of movements up like that, and he was having symptoms for about 3 months until he had surgery. Some things to reassess on the next treatment session for subjective is his sleeping. He's been complaining of symptoms disturbing his sleep. And also when he's side lying, he's complaining of symptoms also. Objective findings to reassess is his surgical incision on that right shoulder was very tender, so were the muscle bellies of the rotator cuffs muscles. So just palpating those and reassessing those at the next one. And also his posture, he had increased thoracic kyphosis. He kind of had slumped over shoulders. So that's something that you could reassess at the next, at each session. Okay, and he had, at the initial evaluation, he was having pain with joint mobilizations grade 3 and 4. So to continue improving his flexion and abduction, we should do joint mobilizations grades 1 and 2. So that will help improve flexion and abduction without causing those extra symptoms and pain. Like I said, in the initial eval, he was having pain with joint mobs 3 and 4, so you want to drop down to 1 and 2, and also just that limited shoulder flexion and abduction is going to be, a good reason why you need to go to a joint mob 1 and 2, posterior and inferior. Okay, and this is a demonstration of posterior and inferior joint mobilization. Today I'm going to be showing you how to do an inferior joint mob grades 1 and 2. Now grade 2. Okay, and this improves abduction. The next I'm going to do a posterior joint mobilization, grades 1 and 2. Okay, and grade 2. And this improves flexion and internal rotation. Okay. And the next thing, it's important to educate the patient on how to properly sleep at night so that those symptoms don't keep increasing. Like I said, he was complaining of pain at the initial evaluation, disturbing his sleep. So something to help with that is getting a sling, like you see here. It's an abduction sling. It'll kind of keep that arm in a more comfortable position, kind of slightly in an open pack position for that shoulder. Get him something to rest on, a little bit more stability, and also it could help with abduction by kind of keeping it in that instead of right up to you, can help with increasing abduction. And like I said, he has those symptoms at night. He reported that in the first eval. Okay, one exercise for the home exercise program that he should do are pendulums. And those are basically, you want to perform those to help improve range of motion, and that you'll improve range of motion by loosening up the shoulder joint by kind of letting just gravity assist that arm coming down and hanging. It'll help with pain by loosening up that joint and overall mobility, which will then in turn, if you do it properly and enough, it will improve range of motion, which that's one of the goals we have with this patient. Some objective findings for this is he has muscle guarding and a soft tissue infeel with passive range of motion in his right upper extremity. So those pendulums will kind of help with the muscle guarding by relaxing a little bit more, and will just help that patient, be able to get some more range of motion there. It's imperative that this patient does not move the arm, doesn't use force from that arm to move it. He uses force from his body rocking back and forth to let that arm dangle and move on its own. That is very critical for the patient to know, because this is a passive range of motion exercise only. There should be no active movement in it. Also, if pain is present, the patient needs to stop doing it. That's just, we want to make sure that we're not increasing pain, we are decreasing pain. And he should also breathe normally throughout. This is something he can do for 2 to 3 minutes, 3 times a day. And once you move on to active assist and active range of motion, we will stop doing these pendulums. But for first initial eval, weeks 1 to 4, these are very important to do. And here's a demonstration of the pendulums. Today I'm going to be teaching this patient how to do a home exercise program called pendulums. Okay, so first what you're going to do with your left arm, I want you to support yourself and bend over and have your right arm hanging, and using the force from your body, don't move your arm. You're going to sway back and forth, and your arm will go with you. So we're going to do back and forth, and then you're also going to do circles. And move your body so that then your arm will move. You're going to breathe normally throughout, and you're going to do that for 3 minutes for each motion. Do you have any questions?
No.
Okay. Okay, now circles. Okay, very good. And also with the pendulums, this patient will go in 2 different motions. It'll be side to side and then around in circles. And like I said, his body motion should be doing that, not his actual arm. So overall, this patient's prognosis between the initial eval and the 8-week eval is very good. His rehab potential is also good. He has been meeting goals. He was a painter before, so we know that he needs a very good range of motion to get back to his functional activities. So we expect at 16 weeks with a rotator cuff repair for this patient to have full active range of motion and begin endurance conditioning, strengthening, really getting that strengthening the arm back up to return to that complete functional activity in his ADLs. The next step after his 8-week eval to kind of progress further into the rehab at 10 weeks, probably want to go further into active range of motion, and really hoping to have full active range of motion by week 10. But as far as how his progress is going from initial eval to 8-week, he's progressing just like he should. His symptoms are decreasing whenever he sleeps, and the doctor is ordering a 5-pound weight that he can do, and his goals are also increasing to include weights and activities that'll help him return to his ADLs. So overall, this patient's prognosis is very good. And that is the end of the slide. Thank you for watching.